Good Monday morning, everyone. It is February 14th. I'm Jessica Lovell. Welcome into the Morning Medical Update. Okay, how many times has your man forgotten Valentine's Day? What about your birthday or other special days in your life? Well, it might not be intentional. So Dr. Greg Nawalanic has been brought in. He is a psychologist here at the health system. He's going to help us explain the role and help us understand exactly what's behind all this forgetfulness. So not just a guy thing, though. Okay, Dr. Steve Stites also here. He's our Chief Medical Officer, of course, and he's going to update us on the latest on COVID and its impact here on the health system as well. So make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. Those links are right there on your screen. But first, let's get to Dr. Dana Hawkinson with our COVID count this morning. Good morning to you.
Hi.
Hello.
Yeah, happy Valentine's
Hi,
Day.
you as well.
It's
You as
cold
well.
Monday.
It is, right?
But, even though it's cold outside, I think we should get a little bit of warmth, understanding that the overall cases have continued to decrease. The overall hospitalizations have continued to decrease. And recently, nationally, we also saw a slight decrease in the rate of death as well. So right now here in the health system, 55 active patients, 11 in the ICU, 6 on the ventilator, and 79 meeting that recovery period. Unfortunately, we did have a death over the last 24 hours. But again, Steve, the overall trend the last 10 days for hospitalizations has decreased.
Yeah, you got to like it, right? And let's show a few things. First of all, yesterday was a National Day of Mourning. You may not be aware of that, but we've got some pictures that show a little bit of some of the sunset people had during the National Day of Mourning as the Chiefs were not in the Super Bowl. Let's just talk for that about a moment, because it was a tough day. But fortunately, today is Valentine's Day. We're seeing red again. We're seeing the happy side, not just dressed in black.
So Men in Black, this is your son.
This is my son. That was my son, yeah.
So you were, what was it like watching? It's never fun to watch a Super Bowl without the Chiefs in it.
No, it was just painful.
It was painful.
We were in mourning. I told you couldn't. We had a little Super Bowl party at my house, but the dress code was black. You had to wear black to get in. Otherwise, you couldn't be in the game. You couldn't come because it was a National Day of Mourning. But fortunately for you, that was followed by Valentine's Day.
Yes,
And
I'm here to warm your heart.
Well, we're going to talk a little bit more about that, because I do have something to talk about when it comes to mansplaining. But first of all, let's talk about COVID-splaining, because there is a splaining to do. The numbers are better, no question about that. And we're seeing the things drop in our hospital. The numbers drop in our hospital, which is great. We peaked at 224 a few weeks ago, and now we're down in the 150s. So clearly the right trend and a good drop. It is not just to say that the rate of spread of Omicron and the number of hospitalizations with Omicron is just under now, across the country, is just under the peak of any other wave. So it's not like it's gone away. We still have a whole lot of COVID going on. But what I think we can take heart is that many people are vaccinated, which is great news. We had a question over the weekend about, that vaccination really doesn't help. And I don't know what part of the data they're looking at, but that's just wrong. Guys, do you have that one graph about the 20 times death rate? Nope. All right, so there's some good information out there. It's in the New York Times. We can bring it in tomorrow. That the number of deaths in the unvaccinated is 20 times higher than the vaccinated. So if really a vaccination didn't work, then that would be equal. But that's not what we're seeing. And in fact, what's really happening is that there are three groups. There is the group of people who are fully vaccinated, which I'm going to define it, and that means you've been vaccinated and you've had your booster within the last 6 months. I'm going to call that fully vaccinated. The hospitalization rate, the number of people like that in our hospital in our deaths are less than 10%. I mean, it's a really small number, even though it's about a third of America. Then if you step back and you say, what's the death rate, and the folks who are vaccinated but not boosted, or that's been for a long time, or they never finished their vaccination, it's much higher than those who are fully vaccinated. And then if you look at the people who have never been vaccinated, it's much higher than the other two groups. So it's all about a gradation. The safer you are, the safer you are. The other problem we have is that America is no longer easy to divide into those who are and those who are not vaccinated, because it's gone so long. Plus, you have to throw in people who have been infected. Then you have to throw in whether they've been infected by Delta or Omicron. And suddenly it's a potpourri. Potpourri? I said it better that second time. Potpourri of all these different categories of patients. So it's a hard question to answer, but what we can tell you is that deaths is very clear, as the New York Times data reflects, 20 times higher, 20 times higher in those who are unvaccinated than those who are.
So still a pandemic of the unvaccinated.
It is clearly a pandemic of the unvaccinated, especially it's a pandemic death of the unvaccinated.
All right, let's see if we have any reporter questions on the line today.
Good morning, Charlie Keegan here from KSHB. Happy Valentine's Day.
Happy Valentine's
Hey,
Day.
Charlie.
With it being Valentine's Day, I wanted to ask a heart-related question. What, if any, kind of long-term effects on the heart have you seen from COVID-19?
That's a great question. We had a good program on that on Friday. You know, probably the worst one, Hawkeye, is really long COVID syndrome, because you see this thing, the postural hypotension syndrome, where people have difficulty exercising, they have difficulty with their heart rate, they have a lot of problems with a very fast heart rate, they drop their blood pressure significantly. It's called POTS, and I think that's probably one of the most significant outcomes of COVID-19 that is part of long COVID, along with exhaustion and muscle aches and pain and difficulty with exercise. But just if you look at the heart, there's also some cardiomyopathy that goes on that is a weakening of the heart muscle. That's more in the acute phase. This long phase of loss of your ability to regulate your blood pressure and pulse correctly, Huck, I think that's probably the worst of all the long-term cardiac effects, outside of the acutely ill, transplant, things like that.
Yeah. If we're specifically talking about the long-term effects of long COVID, so again, typically that tends to be 12 weeks, 3 months after that acute infection. And those we're seeing, you are seeing effects if you had like an acute heart attack during COVID. You're still seeing some effects there in the muscle, just as you talked about as well. Also, arrhythmias, meaning your heart doesn't beat properly. So a lot of those things we have seen. We know that there is cardiac involvement in that long COVID syndrome. I don't think there's really any specific rhyme or reason as to who gets it and how severe it is. Certainly if you are having more severe disease, you are at more risk of severe long-term complications from that, but we know it can affect the heart in various ways.
And we also know that people who are vaccinated, getting back to that question, have a markedly lower rate of post-long or long haul. And secondly, even if they have long haul, it's not as severe. So there is, once again, a clear and important reason to be vaccinated. And it's interesting, we fight a lot still about vaccination in the United States, but it's getting to be a smaller and smaller group. If you look at those over 65, the most vulnerable, they have chosen to clearly be vaccinated. 95% of people over the age of 65 are vaccinated. So I think, it just says to us that the more you feel the risk, the more you want to have the protection. There's just no question that vaccines are safe and protective. They are much safer than COVID, much safer than long-haul syndrome, and much safer than having any of the cardiac effects here on Valentine's Day from long-haul syndrome and COVID.
It all comes back to vaccination.
It all comes back to good health habits. And what you remember, no one of us want to live in isolation forever. Even here in the health system, we're talking about, gosh, when do we get to go back to meetings? And someday soon, we hope we can even take masks off in meetings. But you don't know that yet, because we have to wait and see how the data shows, what the data tells us. But, we've expressed optimism here that by, late March, early April, mid-April, whatever, we're going to think that we're going to be in a better place as this Omicron wave begins to recede. What you also see on that New York Times heat map is how much it's receding. And again, let's guys, can you bring up that map, the 20 times death rate? There it is. I surprised them, and they're not sure which direction I'm going to go in the morning. This is the map that shows you the average number of daily cases, still twice as high in those who are unvaccinated. And the other part of that map is the number of deaths, which is 20 times higher in those who are unvaccinated. But also the heat map is beginning to lighten up significantly throughout the country. It's gone from dark purple to lots of light yellow. And that's a much better map than what we were looking at even 2 weeks ago. As that continues to get lighter, then I think it gets safer and safer. You look at the Northeast in New York, where they're talking about taking masks off in stores and in restaurants. Look how light the color is. And again, this is a reflection of how much risk there is in any area. It's a combination of vaccination and people who have had COVID and what the community transmission is like.
But what about the West Coast?
Much less. Still dangerous, right?
And they're lifting them left and right.
Yeah, and you look down in Kentucky and Tennessee and Virginia and West Virginia and Florida looks a little tough. But even in the Midwest, where we'd seen a lot of the initial last couple of waves with Delta and Omicron, beginning to lighten up. And I think I look forward to that means we get to lighten up our mood, lighten up our story.
I think there was that graph in there too of the vaccinated versus unvaccinated.
Yeah,
cases.
Yeah, we'll pull that one up tomorrow.
Did I hear you say you're excited to get back to meetings?
Well, I mean,
You know
he's in
you've been in
person.
isolation too long. I'm
I know.
excited.
Well, that's because if you just sit at your desk all day, it's like an invitation to eat a whole lot of food and then to not exercise and just not move as much, and you just get to relate to people, and we all want to do that. So yeah, bring it on.
Thanks for keeping this meeting every day.
We
Hustling
try.
down
We try.
here.
Yep.
Greg Nawalanic, Dr. Greg Nawalanic, how are you today?
Great, Jess. Good morning. How are you?
Happy Valentine's Day. Thank you for dressing for the occasion.
Thank you. See you as well.
Yep, I do what I can.
I
Good to
wore
see-
some red.
Why you wear a red vest today?
I still think you're in mourning.
As
so.
I still,
I'm
you're
a little
you're
dark red. It is
coming
morning.
out of the dark.
It's
Before we
hard.
get to some of the topics we want to talk about, a story you and I did a couple years ago was the depression coming out of the Super Bowl. People that super high and then that super low when you either realize you're not going or you go and you don't come back with the trophy.
True.
And you said that's a real thing, to have this like super high and then just the crash can actually bring on some true depression.
Yeah, I mean, it's just our body's like kind of this baseline level. And when we have anything that goes really to a positive, then we kind of balance and have a bit of a negative. So if you think about any time you've ever gone on a trip or a vacation, when you come back, like even the last day of the trip, there's just that case of the blues that kind of set in and that funk about like, oh, I got to get back. And so similarly, we have these big highs out of majorly exciting events that then afterwards are like, oh, it's just, that's over. Now back to life. Okay. And then obviously the upset of not making it, and Dr. Stites with the
National Day of Mourning, dress in black.
Yeah, the here on the morning show. So I was thinking about that story that you and I did a couple years ago, and people out. We were talking to people out on the streets. They were like, I just can't quite this. It's just such a euphoric feeling, and then it's just such a buzzkill. So, okay. So I do want to talk about something before we get to Valentine's Day. It's just mental health in general. This has been a major issue throughout this entire pandemic. Any positive news to share?
I think some of the positive that I have is that obviously during the pandemic, from its inception all the way till now, and seeing the spikes, telehealth was kind of the real benefit, and it was the stopgap that allowed us to really still provide services for people safely and effectively. But what's been interesting to see is as patients have started to come back, because I had a handful of patients that I'd never actually seen in person. It had all been telehealth. Mm-hmm. And so as we finally got to the point where everybody was vaccinated, everybody had been well, having them come back in person was actually a really interesting development. And I think it's been really great for the patients to get back in person, because I think there's going to be a lot of research and data that's going to come out about the effectiveness of telehealth. Because, as I said, I think it's a great stopgap, but the difference of being in person for individual therapy is just, it's remarkable. And in fact, some of the patients that had only seen telehealth when they came back in person kind of had a bit of a backslide therapeutically. And then afterwards, once they kind of got over that hump, really started to make more longer lasting and sustainable steps and progress.
I would imagine in the beginning of the pandemic, though, you may have been the only voice and face they saw, even through Zoom meetings.
Yeah, God help them.
Right. Well, we are glad that you were there for them. Are you, as people are starting to enter the third year of this pandemic, I mean, are some of the issues changing? And just kind of what advice do you have for people who are still struggling?
I think that some of the problem is that what I've seen largely in higher functioning individuals, high career oriented folks, when you think about their lives, they go through school and they're working towards goals. And sometimes recreation can take a bit of a backseat. And so that's something that we'll see people show up in therapy for, because they're depressed or anxious, and you try to help them to find some recreational outlets, some positive coping, some adaptive activities to get into. And the pandemic really knocked that for a loop, because you couldn't say, well, why don't you just go take up a bowling league or get into whatever? I mean,
something you might suggest before, you can't do now.
Right. Not that was exactly the thing that I would have suggested.
Think it was,
but I mean, hey, if it works for you, the dude. But the idea here is that it was really difficult to try to help people to find ways to get out and be recreational and be engaged socially. And so now that's starting to shift a little bit as people have gotten vaccinated and are starting to feel more comfortable getting back out and doing things. So that's one major issue that we've seen shift. Other than that, I mean, I think a lot of people have really kind of adapted to the work from home culture, and that's produced a whole other host of issues in terms of where you used to have for some, work is actually a respite to get away and get to your office and kind of have your own space. Having that taken away, and now you're at home and maybe with your spouse and or kids all day, every day. it puts a lot of strain on the home life because you're not as excited to see them at the end of a long day of work when you get home. It's like, oh, you again. Great theme for Valentine's Day, right?
Hey,
But-
it's reality.
Sure. But the idea here is that, so we've had to work on trying to figure out structuring what the home work life looks like, how to kind of build in breaks from each other. So a lot of different things that have come up, and now we're starting to see, obviously, a little bit of a return to normalcy, hopefully.
And
So-
Dr. Stites, is that something that when you, and Dr. Hawkinson can jump in too, but when you see patients in clinic, is that just a question that comes up? How you doing? How you doing up
Yeah,
here?
you know, we talk a lot about that in our clinic. I did the CF clinic, and there's a lot of how you doing's going on that always has been, or transplants, same kind of thing. But I think what we're finding too, and it's true nationally, telemedicine is outstanding, right? It's really been great. We offer our patients, you want to come back to see telemedicine? No, 85 to 90% of people want to see you in person. And there's just a difference, I think, that moment, as you've explained, I think that was a great story about how it was hard with that. But then when people started seeing you in person, they made this progress. And I think that's the same thing we're seeing. I think compliance goes up. Everything gets better when people get to see in person and that connection. Just no question about that personal connection. And not to mention, I can actually examine a patient, which I still like to listen to their lungs. But I think that there is a clear difference. I think we're seeing it nationally. Telemedicine is an outstanding tool, especially for people who live further away and may have some struggles or a bad, a couple days last week or whatever it was, we had that we're supposed to have 12 inches of snow, we got like 5 inches. In the years past, we probably would have canceled clinic that day. We didn't cancel the clinic. We just changed a whole bunch of people to telemedicine, and they could still be seen. But 80 to 90% of our patients, they want to be seen in person, Hawkeye, and I think that's probably true in infectious disease. It's true just about everywhere for us.
Yeah, and like you said too, the physical exam for internal medicine, whether it's the lungs, examining the joints, the heart, all that is important too. But I think it does allow for people who otherwise normally don't get out to be able to get out. But in those circumstances of weather or something like that, certainly the telehealth, the video appointments do help as well.
I think the surgeons struggle to do post-op wound checks as much. You can do it on telemedicine, but I think they like seeing you in person.
But I asked that because it's similar to like kids going to school. It's just another person to check in on that and to recognize if there's something that you need to send them to get maybe some further help.
Right, and I think people mistake our constant messaging about get vaccinated, get a mask on, do this, do that, stay, take care of yourself. A lot of that was, again, you're building your airplane while you fly it, weren't able to keep it safely. Then we realized, kids can stay in school if they stay masked. And what we've been saying all along is, man, the problem is when you take off the mask, they're all going to get sick. They won't be in school. Then the teachers get sick. Then the school has to close, kind of what we saw with the Omicron wave. So again, as the numbers begin to recede, should masks come off in school? I think they probably are going to need to, because we know that's a better experience for kids, right? But you just want to do it at the right time for that. And that's, I think, an individual school district question, because you have to look at the infection dynamics in your own community.
Anything to add, Dr. Nawalanic, now that people are out and about and getting back to seeing family and friends and school and maybe going from home work back to the office, are there people reaching out? What are you seeing as far as that?
I mean, I just think that at this point, everybody's just so excited. And I think we're also seeing people getting back in two different ways. One is that they're just done. And I think that's what, obviously, we saw the Omicron spike. That was clear evidence that folks had just decided enough's enough, I'm done.
Yeah.
And then we also have the folks who really benefited from actually being, cautious, doing the right things, taking the steps. And so they were able to re-engage in a more confident and comfortable way. And so, we're seeing people that are just very excited to get back and have the connections again with family and, return to some of the old issues that you get over that hump of the reunion, and then it's like the honeymoon ends and we're still back to trying to knock each other out. So, just kind of helping people to cope and handle relationships same as it ever was.
And it's not, I think you have to realize it's not just the light switch on and off, right? You have to kind of picture your battle. So my wife and I are both 62. Happy Valentine's Day, dear. So we went to a restaurant on Saturday night. And we haven't been going out to restaurants for a while. And here we're, okay, Omicron's a little better. Well, what do? We get there a little earlier. We sit in the back by ourselves at a table. We eat a little quicker, and we head out before the crowds really start to pile in. And that felt really good. And I had a great time. We had a
You
great
found
time.
balance. You got to do what you wanted to do.
And I think that's it. It's about the balance, and everybody has to. Again, if you're 25 years old, the balance is a different equation than if you're 60 years old.
Yeah.
And I think the data would clearly indicate that the older you get, the more risk there is from this pandemic. So you just have to just make your choices and fight your battles that you can, and do the best you can. And each person has to kind of follow their own guidelines. But the one guideline I say we all should follow is trying to keep each other safe. And so if you're going to go out into a really crowded indoor place, and if you don't feel well, A, don't go, and B, if you otherwise, make sure you put a mask on, because that's still the safest way to do it. But as things begin to ebb, I'm really hopeful we're going to be saying, yeah, okay, maybe it's not as critical as it was. So we just have to wait and see how this pandemic rolls.
All right, it is Valentine's Day, and Nawalanic, I'm coming after you.
Oh, boy.
So I
Here
want
we
people to
go.
make sure they're sending in their questions, because Dr. Nawalanic will answer any questions about mental health. So most importantly, make sure you send those in if you have them. Of course, we'll get to your COVID questions here in just a little bit, but we're going to have a little bit of fun, and I'm going to help you. You're going to help us kind of mansplain a few things today, okay?
Oh, here we go. Wait
Here
a
we
minute.
go.
There we
Okay.
go.
So-
We got. Wait a minute, Jess. I
That's
just
it.
have to. Jess.
Sorry,
I
sorry.
brought something for you.
Oh,
Happy
great.
Valentine's Day. Here we go.
Do I really get a present?
Yeah, this is a
Got
candle
props.
for mansplaining.
Oh, yes.
Yes, it is. I actually, my
I can't
CF
imagine
team,
what it smells
well,
like.
the nurse I've
Oh, I
been
know
working
what it
with for
smells like.
18 years. No, the nurse for 18 years, Joyce, she gave this to me because she says sometimes I mansplain things. I never would have figured out that pencil sharpener without you. Smells like thank you so much. Take a big whiff of
I'm
that.
gonna take
It
a big
smells
whiff of
really
this.
good.
Let me
It smells
see.
really
Yeah.
good.
Oh, yeah.
I want to point out something though.
Oh, this smells like I never would have known how to do that without you telling me how to do that. That's
kinda-
exactly what
I
that
think
smells
that's
like.
what they were trying to go for. It was from the whiskey candle
Were
company.
you
What
able
would
to
expect
smell it
them?
okay? Did anybody need to tell you
Yeah,
how
no,
to do
so
that?
just
to get
lean
that
in and then just-
That's
Okay,
it. There
you know
it
what?
is.
Just to say, there may be mansplaining, but men of the world unite. There's also she-wishing.
This is true.
There is she-wishing.
And you're welcome.
Butterflies, unicorns,
You're welcome.
and moonbeams, or we could call it a bum.
Who gave this to you?
The nurse I worked with for a long time, Joyce Hawk. She thinks sometimes I
Joyce gave this to
mansplain.
you?
Yeah, you know, it's kind of like sometimes
She's
I,
like your work wife. And so
yeah,
she knows
I
you
suppose.
best.
Yeah, I don't think she thinks that's true, but I think what she would say to you is, you know, you really don't have to explain to me that lab bag anymore.
Because she's only been doing this how
I've
many
been
decades?
I've been working for 18 years. I think I know that, and so I believe she would call that
But Dr.
mansplaining.
Stites, thank
Yeah.
you so much for explaining to
Well,
her
that-
once
that-
again.
That's sort of it. But there's
Fantastic.
she-wishing, butterflies and unicorns, and moonbeams. You know what that means? Bum.
Okay, you got a candle. That says a lot. Okay,
I'm just
Dr.
saying.
Nawalanic. Okay, so it's Valentine's Day, Day of Love, and if your man forgot, well, it's still early, so you're not alone, but it's still early. Give him some time. A Canadian company that provides the technology for dating services finds that 41% of men surveyed tend to forget the romantic significance of today compared to just 22% of women. And I do admit I do forget significant, important dates. So there's women out there who do it too, in full disclosure. But Dr. Nawalanic, can you please explain or mansplain to us why the difference, the 41% versus the 22%? Why do men forget more than women?
What is today? Is it your
Yeah.
birthday?
Thank
Happy
you.
birthday. Jess.
Thank
It's
you.
really great.
I knew you would never forget.
Yeah. No, so basically, when we think about gender differences, we have to understand that by and large, there are a lot more things that we have in common than dissimilar. That said, and that applies to abilities, intelligence, any number of different competencies. I just want to come out with that first, so that's covered. Now, when we think about gender differences, let's talk first about maybe the reason why there are differences. There are a number of different areas that people look to determine, why do we think there are these differences? And one would be cultural significance. Although the argument that it's basically that men are programmed to be this way and women are programmed to be another way by our societal expectations, that loses a lot of weight when we look at studies done with rhesus monkeys, where they gave rhesus monkeys toys that were either had wheels and blocks or were very plushy. And the male monkeys tended to go and play with the block wheel having ones. And the females would all go with the more plushy toys. Now, I don't think that rhesus monkey culture would dictate that the males should go play with the traditional male toys, and that the females would play with the other. So that speaks to something more. What we look at then after that would be genetic expression, which when you're in utero, there are certain swells of different hormones like testosterone, and that can alter the course of brain development as you get this or not. And so what happens in brain development, We know that organically the male brain is larger than the female brain, which means nothing about intellect. It's just, we're just speaking organically.
We believe you.
Okay. And so, and then we also know from different studies that have been done that females tend to have a more integrated, where they're using all parts of the brain kind of collectively, whereas male brains are more localized in their use of different areas of the brain. So all this comes down to explain that women are going to be, they've been hardwired, and evolution is the other thing. We have to think that once upon a time, we were cave people roaming the earth, grunting and picking bugs off of each other. That's how we started talking to each other. Was, if I pick bugs off of you, you survive, and then since I help you, you pick bugs off of me. Then we start grunting and making sounds that make us feel like, hey, that felt good, And some of that still goes on.
That's what I was going to say.
Yeah, we still do that.
Okay.
But the idea here is that we've evolved to have different specific abilities, strengths, and weaknesses. And so when it comes down to why does a man forget, it's not necessarily that he forgets Valentine's Day, but he may very well forget your first Valentine's Day. He may forget your first date. He might forget any number of different memories that are real flashbulb moments for the female counterpart in the relationship. And the reason for that is that evolutionarily, organically, whatever it is, females tend to attach more emotional significance to memories. They kind of put more things on a special shelf with a flashlight on them, as opposed to men taking it and saying, oh, this is important, put it over there with the others. And so the idea is that it's not about the man being insensitive. It's not, although in some cases, I mean, look, I'm not going to defend every man and say, that's it, we just all forget everything. Because, the same guy that might totally forget the significance of a date or a place or a location for a story that happened in the course of a relationship, he can probably rattle off all of Patrick Mahomes, Tyreek Hill's, and Travis Kelce's stats from last year. So
with that, you have just erased everything you just said. As a woman, you're thinking, okay, so what gives?
Well, here's the thing. It's a little bit about motivation.
Okay.
Yeah, okay, so, but don't you think she-wishing is also true?
Okay.
Butterflies and moonbeams, come on.
We can absolutely get into that too. I don't know that needs to be gender specific, because I think it's really about relationship expectations is what this comes down to. And the idea that, for some, all right, men and women both, how many people out there hope that their partner will eventually change to be something they're not today and that they've always wanted them to be? She-wishing.
She-wishing.
But I don't know that we need to call it she-wishing. I think it goes both ways. And I think that the idea, I think there was a book, several years ago, You're Perfect, Now Change, I think was the name of it.
I remember that book.
That's one of these things where we really we get involved in a relationship, and I think a lot of people, to go deep on this Valentine's Day, go into it looking to check a box. They want to have somebody they can take to the family, somebody they can show off to their friends. Oh my God, have to get married. And I think our culture has a real problem, with this concept that we've got to get married. We don't look at it that it's like we have to find someone to get married, not that we find someone who makes us a better version of ourselves, who helps us to feel more complete, who helps us to feel challenged, to improve ourselves, to try to live a better life. And then as a result of that, marriage becomes a secondary thing that, of course, why wouldn't I want to spend the rest of my life with you? But instead, we get a lot of people who, it's like, all right, you know what, you're meeting about 30% of the things that I want, but I'm sure we can change the other 40 to get to 70. Let's do that. Let's go get married. Let's make this. You want to do it? Let's do it. All right, we'll do it.
So the good news is I already got my wife her Valentine's Day present, because after being married for 35 plus years, and pretty darn good, right? She's a pretty cool lady. I did good. Some bright red, and that she thought wasn't right. My wife's in really good shape, but but these exercise pants, because she and I work out together. I have a lot of time. These bright red exercise pants.
You bought your wife exercise.
So she said to me, she goes, most people would be insulted, but I know how much you love exercise. We like to do it together. So this is actually a cool gift, but this may not have been your finest moment. But they were so cool. I would all over. I found some. I went over and found them.
I'm going to let you get by
I also
them because you did buy them.
I got a cool pink fishing shirt for her.
Okay.
That's she just kicks out. And I'll get
Okay, you just made my heart beat. That when you
Thank
said
you.
water
And plus,
exercise.
exercise pants are kind of a uniform for a lot of people now.
They're
They're
just
not just for
pants.
exercise.
They're
Wears
pants.
them
They're
everywhere.
pants.
She wears red well. So
And I
it'll
admit,
work
I
well.
forget every birth. I'm horrible at remembering. I could be friends with my 40 years friendships. I'm like, is it the 7th or the 8th? And I never remember. My spouse remembers, you know what today is? This is the date of our 3rd date. This is the anniversary of our
Oh,
3rd
wow,
date
that's
12 years
impressive.
ago. And I'm
That's
like,
impressive.
oh, yeah, of course it is. Yes, yes. Who could forget?
What's that
Who could
from?
forget? I know.
man.
So I have to. I can't throw him under the bus because he's pretty good at that, and I'm the worst. So okay. So sometimes men can get it right, but they need a little reminding and maybe a little bit of help remembering what to do. So I have to set up this fantastic video for you guys. I don't think you guys have seen this. Okay, so our news director, Jill Chadwick, her hubby simply knocked it out of the park this morning. However, it took a village to pull this off, and it started with a call from my husband to me, asking me for Logan and Cliff's information so that her husband, Darren, could pull off some surprise. Here it is.
Oh my God! No! Oh my God! Oh, you honestly scared me to death. Who's this from?
Who do you think?
It's got to be Darren. I would say Becky, but oh my God.
Okay, so Becky works with Darren, and so the first thing out of her mouth was, "Oh my God, this is so great." Becky must be behind this. Meaning Becky was the one who reminded Darren to do it. Either way, he pulled it off really well.
That's impressive. Can I just say, dressed in red because it's no longer National Mourning Day and it's Valentine's Day. It's appropriate.
Perfect
It's
transition.
perfect,
great.
and I
Well
thought that
done.
was just a killer gift. That was
That is a killer
fantastic.
gift.
Okay, so it's not okay. I want to talk about a couple other things. We talked a little bit about the difference between men and women and the way they think. But do you think it could help us kind of bridge the divide? You know, the whole men from Mars, women from Venus thing. It sounds great in a book, but I mean, how do we understand each other a little bit better so we can have better relationships?
So I think really it's going to come down to accepting that there are differences and that there are strengths and weaknesses on each side of the coin. And maybe that we actually try to, coming back to mansplaining and she-wishing, maybe we try to listen to each other. We try to, I understand mansplaining is a real talking down thing, so maybe not that. But as far as, everybody comes into a relationship with their own areas of expertise, so to speak. And so use that, kind of allow each other to introduce each other to things and listen and know that this is somebody that you're looking to spend a lot of time in your life with. And so, and I'm guilty of this. I'm not going to lie. Like my wife she's a voracious reader. My doctoral program killed reading for me. I'm just kind of over it forever. I mean, I still read when I have to, but it's like I have to. But she'll tell me about, things that she's reading, and a lot of times I get kind of like, okay, yeah, that's great. And I'm trying to work on being better about that and not shut down. And now I even ask her about her books, like, hey, what you reading? She's like, why do you care? I'm like, well, I do. I mean, I'd like to know. Tell me about it. We'll see how it is. No, it's true. But it's about acknowledging that we all have room for improvement and we all have room for personal growth, and that it's one thing. Certainly, it's important to do it for yourself. It's another thing, and maybe it's when we talk about having that kind of prodding to do something. Look at your partner as the reason sometimes to take something new on, and when we come together, understanding that there are inherent differences. There's going to be strengths and weaknesses. Don't expect everything from them, and just know that we've all got ups and downs.
All right, we're going to get to community questions. And the first one is from Isaac. A question for Dr. Nawalanic. Has the pandemic ended dating as we know it? All the fun stuff that we used to do, and the eating out, and all the bowling we like to go doing, and
Best
movies.
Super Bowl commercial, Peyton Manning, Serena. Bowling commercial, that's the best.
Yeah, it was good. I don't think it has. I think that it might look different for folks who are cautious, but I think that absolutely not. Dating can still absolutely happen. Now, of course, there may be different upfront questions like, are you vaccinated? are you on the internet often? Are you a fan of QAnon? Yeah, these are certain questions that people might ask now that they might never have asked before. And as they ask these things, they might be deal breakers for someone, and we have to accept that.
You're not wrong about that. That is true. And I know people
I'm
out there in the
rarely
scene,
wrong.
you're never wrong.
I'm kidding. I'm wrong.
Mansplaining.
Ask my wife how often I'm wrong, and you will get. She's always right. I am always wrong.
duh.
By the way,
I know how that
I'll
goes.
follow Dr. Stites. Happy
Yeah.
Valentine's Day. Honey.
Yeah.
Very good.
But the idea here, no, dating is not dead. It's just going to look different. There's going to be a lot more hand sanitizer involved, a lot more questions up front. That's it.
And then it's all bets are off.
Yeah, but I mean, you can get out and eat. You can Top Golf, not to be that is not a sponsored thing, but I mean, it's something that's kind of outdoors-ish. Which right now the weather, I don't know if it's so great, but I mean, we did just have 60s. It's supposed to happen again, but there are things that you can do that you can be safe.
Very different from the beginning of the pandemic.
Yeah.
To now. Okay, so let's bring Dr. Hawkinson in, and we're just going to talk about COVID with you today. You're welcome. I'm scheduled for my booster tomorrow. How long until it takes effect? That's from Kelly.
I think, again, the conventional wisdom is about 2 weeks after that vaccine dose. I think if it's your boost, meaning your third dose, you should garner a lot of that protection probably by about 10 days, but usually it's in that 10 to 14 day where you will be considered fully protected.
Joellen wants to know, do you think we will get a recommendation from the CDC regarding boosters every 6 months? Anything to update on that?
Yeah, I don't know. That's a good question. We've debated that here inside the health system. There are other experts who say that you really don't need more than 3 doses. It's those 3 doses that help. Also, you have to consider people who are infected or reinfected as well. I think there continues to be good data coming out, though, about the reduction or decrease in vaccine effectiveness against hospitalization when you start to get further out from your vaccine dose. So that question is unanswered right now. We know that certain populations, it may be more beneficial, especially those over 60, over 65, to do that. But we will wait for some more of the data from Israel, which initiated that 4th dose campaign a little bit earlier, and just kind of see what else. Historically, and Dr. Stites has talked about this too, the VA has provided very good evidence and data supporting for or against these types of things. So I think right now we just have to wait for the data.
Hawkeye, wouldn't you say too, it's a little like influenza. If you think about, if you get really vaccinated early on for influenza, and if you're a high-risk patient, some of us still even say, well, you need a second influenza vaccine later on, because it's going to have its most effectiveness for about 4 months, and then it begins to tail off. It's for some of these high risk. So Omicron's really no different, or COVID is really no different than what we've been saying for influenza for years and years.
Yeah, and I think that's another interesting point too when we compare it to influenza or other cough and cold viruses, which tend to have a seasonality. What we found for the past 2 years is that it really does kind of just run all year round. Is there a chance that it could develop into more seasonality, especially I think with people's behaviors of doing things more outdoors when it's warm weather? That could be as well. But those are just all of these details that play into really the disease process, but most importantly, keeping you out of the hospital. So hopefully we'll just kind of wait and see what bears the fruit from the data and the information.
And
My
clear
8-year-old
difference about 65 and above. I mean, I think you're right, Hawkeye. You mentioned I think we could end up seeing different recommendation for different age groups.
Yeah.
Well, that was my next question. My 8-year-old laid in bed last night. Mom, when do I get my booster? I was like, wow, thanks for asking. I'm not sure, but I'll ask the guys tomorrow. So do we know if and when or why kids would need them or not need them?
No, I think that this plays into it all as well. So again, number one, with children, pediatrics, we've always said, and luckily, for the most part, they have been spared the rates of the ill effects, the hospitalizations, the severe disease, compared to adults or older age groups. So that is one good thing. Certainly get them vaccinated, because we know children can get long COVID. They still can get ill. They can get the multi-system inflammatory disorder as well. So it is important to get them vaccinated and up to date, or with that booster when that is recommended for their age group. Will they need one on and on? Again, I think a lot of this also goes to people, individuals, and are they infected? Are they reinfected? Infection can give you some sort of immune boost, especially towards other areas, other proteins on that virus. But we all know vaccination continues to be the safest method of immunity. But as we move further into this, new variants will arise. We'll just have to see really what comes out of that.
So this was sent in by Amy. Maybe we could help her out or at least tell her where to go. But she said she's had day-long headaches ever since, like just a few hours after getting her second vaccine back in January of 2021. So these migraines, they've gotten worse and worse. She is seeing a neurologist, no improvements. She has had 2 concussions in the past, in 2015 and 2018. She said it's very painful. She's very frustrated. Just any insight of what, if that was your family member, where would you send them? What would you want them to do?
A couple of thoughts. So that's a great question. First of all, unfortunately, we've had a lot of experience in my family with post-concussion syndrome. Is my middle-aged, my middle daughter Sarah, who's been on this program, actually has struggled with that, and it's very real, right? And the problem is that people with post-concussion syndrome, one of the most common features is headache. So whether vaccine causes headache or it's an exacerbation of the post-concussion syndrome, it's just hard to know. As I understand it, and Hawking probably knows more about it, but one of the things we do when we look at vaccination is you try and see what occurs more frequently in a vaccinated population than an unvaccinated population. As far as the problem is, as you break down the data, you get into smaller and smaller subsets. You say, okay, now I got somebody who's had 2 significant concussions. Maybe they have some post-concussion problem, prone to headaches. What happens in that disease population with somebody who's had vaccine versus people that don't? And I'm not sure we know that answer. We do know that in people who have had COVID, that headaches is a long-term symptom of long COVID. So that's the other question you don't know the answer to just off the bat. What I do know is that if you have a significant concussion problem, there are places to turn. There are headache-specific physicians, and I'd talk to some of the post-concussion docs because there are protocols for coming back from concussion, even concussions that may have occurred 10 or 15 years ago. There are some very specific things that you can follow, and our post-concussion guys do. Dr. Rippey here, one of our neurologists, he's been on this program a few times. Dr. Ford, who also is one of our outstanding headache physicians. Both of those folks are great neurologists. Those are the type of people you go to see when you're having, I think, a problem that you don't really understand otherwise. What I know, though, is that I've not seen any evidence, and Hawkeye, again, I'm going to turn to you. Does vaccination cause headache? I don't think so. Does vaccination cause significant exacerbation of underlying diseases, especially related to post-concussion syndrome? I don't know the answer to that. I know COVID clearly does.
Yeah, I mean, we know headache can be an acute problem. So acute meaning, just for a couple days after there. But for the long-term continual, I don't know what the evidence would say for that. I don't know that there's a lot of data signals to support that. It sounds like there is something else going on. But then I think, just as you said, Dr. Stites, get to a headache specialist, and depending who that is, in our community. And then also there probably are other major headache referral centers around the nation as well that specify specifically in that or in relation to concussion as well.
Peggy wants to know, my husband has had a rash on and off since he first got his shot last April. Many others have rashes continuing. Is this a long COVID symptom? So I don't know. She said he got a shot,
COVID, or they got
but that's what I'm wondering if they were vaccinated, got COVID.
Yeah, again,
trying to figure out which it's from.
Yeah. Clearly there is a post-COVID rash that occurs, and that rash can go for a long time. That's part of the long haul syndrome. Some people have it worse than others. It kind of comes and goes a little bit. Is there a rash with vaccination? There is a rash, but the rash is that I'm aware of is almost entirely self-limiting, Hawkeye, and that which is different than the long haul rash.
Yeah, and I think even one of them, maybe it was Moderna specifically, would occur about a week after, but then, just as you said, was self-limiting, would resolve. We know there are other causes of rashes as well. I'm not sure what the asker of the question said by there are a lot of others. I don't know exactly what that means, certainly anecdotal reports, but we know there can be other reasons for rashes as well. Again, I don't think there's anything, and certainly published data, talking to my dermatology colleagues, there's really no signals about continual problems with that. So I think, again, if you can get to a dermatologist, get to a specialist to evaluate that, and really kind of get to the bottom of the diagnosis and then treatment for it.
Just to say, viral, we call them exanthems, viral rashes after any kind of influenza, cold, GI bug. Those are phenomenally common. They're really common in young children, but then they're still very common in adults. If people come up and they got this kind of thing, what do you see? Well, just let's wait about 6 weeks. It's probably going to go away.
All right, I'm going to get to final thoughts, but I have a question for you, because this is a time of the year that some people might fall into a depression. Holidays do that to us sometimes, but a shout out to all of our viewers who are saying that they're single and happy and never been happier. So yes, you do not need another person to make you happy. But what words of wisdom do you have to people who might use this as you see other people getting, it's kind of the social media thing, sure. Other people getting the flowers and all the love and the candies and the dinners, and you're not. It's okay.
It's absolutely okay. It's just fine. I think that one of the most important things to look at is, just as we were speaking earlier about this idea of rushing to find someone to get married, the idea of rushing to find someone, period. And thinking about the impact of that if we're trying to define ourselves in terms of relationship status, we're missing out on a lot of our life. We're missing out on a lot of opportunities for our own personal growth. And there's a cyclical component to this, that if we're down because of what we don't have, then we start to behave in a manner that's not really true to ourselves. And it's like we're trying to find something for someone else. And the reality is you're never going to get back that time for yourself. And the more that you're taking time to invest in yourself, finding interests, enjoying activities, investing in personal growth, whether it be reading, taking on hobbies, doing whatever, those are things that when you do finally find someone, you're going to have conversational material. You're going to have a stronger sense of yourself, and you're going to have a more formed sense of your own personal identity, which is going to allow you to better engage in a relationship with someone else. So the short of that long mess is use this time, better yourself, take care of yourself, and then you're going to be a better, more attractive individual for anyone else.
Well, and just work on your relationships with all sorts of people, your
Sure.
colleagues, your friends, your siblings, your parents.
Pets.
There's more relationships out there that need love. So
Yeah.
I'm going to bounce it back to you. Just any other final thoughts you want us to know, certainly about seeking out mental health during this time?
Final thoughts. I think really we're as Dr. Stites and Hawkinson talk about, we're getting close to kind of seeing the end of this tunnel. Just kind of stay strong. Know that at this point, as far as I know, there's no other wolf at the door. I mean, once we can get through Omicron, maybe we can get back to a more reasonable sense of life. I think it's reasonable, if you're fully vaccinated, start looking at booking spring trips. It's something to kind of get your spirits up, look forward to something, and just stay safe and take care of yourselves, take care of each other. If you're starting to feel like you've really got the blues, seasonal affective disorder is a real thing. When we're getting a lot less light, the weather's terrible and cold, if Groundhog Day comes and you see 6 more months of winter, which who knows what kind of validity that has, but either way, that can be disheartening to someone. And so if you're feeling the blues, it's not snapping out of it, then reach out to a professional. We're here for you, and we're happy to help.
Valentine's Day always makes me feel excited because I know spring is right around the corner. So it's that final push to get there. So I get so excited about it. All right, Dr. Hawkinson, final thoughts from you today.
I would agree with our guests, but everybody. Right now, it looks like cases, hospitalization, deaths are all trending in the right direction. But just as Dr. Stites said, the cases are still out there, and it's still about the level of the previous peak. So be careful, protect yourself, protect your bubble. The best way to do that is to be up to date on your vaccinations. That means fully vaccinated with those 2 primary doses and having received that booster as well. That will give you some more comfort in being able to go out and do those things that we wanted to do, since before the pandemic, or now since the new Delta and Omicron surge has been going along. So again, protect yourself. You are always welcome to wear a mask into any of those settings that you're in as well. All of those things will add protection to help reduce your chance of coming to the hospital and coming to the ICU.
All right. Dr. Stites, Mr. Sappy,
Yeah,
what do you got?
Mr. Sappy, you know what? It is Sappy. So the best thing we can do is take care of each other, because that's really the best way to say I love you. And to my wife of 35 years, to my 3 wonderful children, and I love them, and I love the folks I work with. I'm very blessed to work in a great place, including in this studio every now and then. And at the end of the day, as we get through the pandemic, I love that concept of let's start making plans for the things we can do. And I say towards the end, I hope it is. I'm sure there'll be more variants, but maybe things are going to be a little quiet for a while. And when they're a little quieter, let's go do it. My daughter got married about a month ago, and that was a great event. We went from, a medium-sized wedding down to about 20 people at the end, and a lot of folks couldn't make it because they either had COVID or they were at risk and things. And so at the end of the day, we're hoping this summer we can get everybody together outside somewhere out in the woods, down deep in the Ozark woods, and I think we're going to have a great time out there. We're going to feel really safe about doing that because I'm hoping things are going to be really good. And so looking forward to those days, looking forward to the days when you feel like Kauffman Stadium's full and okay, and Arrowhead's full and okay, and Allen's full and okay, and not having masks on. I think those days are out there, and we look forward to them. So Valentine's Day, you bet. Let's make sure we're each other's Valentines. Let's make sure we keep taking care of each other so that we can get through to the other side together.
I love that. Thank you guys so much. Okay, well, we know Valentine's Day is certainly more than just about love. It's finding what's true in your heart. And the heart is the focus of a brand new show that premieres this week. It is called All Things Heart. And just like the title suggests, it's about what makes your body tick. And of course, that begins with the heart. We are beyond excited to debut this show this Thursday at 10 a.m. It is hosted by Alexis Del Cid. And here she is now.
Everything in life leads back to your heart. Your nutrition, your emotions, your behavior, your environment, genetics, the air you breathe, the food you eat, things within your control, things out of your control. They're all connected, good or bad, and they're all affecting your heart. I'm Alexis Del Cid. Here at the University of Kansas Health System, the Medical News Network is thrilled to bring you a new weekly live program appropriately titled All Things Heart. Every healthcare provider has a unique experience, every patient a unique story. In season 1, you'll see many of those amazing stories, including the heart connection to transplants, diabetes, epilepsy, cancer, COVID, mental health, dental procedures, and so many others. All Things Heart will encompass all aspects at the University of Kansas Health System, all disciplines, and how they affect the heart. We are so excited to start sharing your stories with the community. Remember, season 1 kicks off soon on Facebook and YouTube Live. See you Thursday, February 17th at 10 a.m.
We will be watching, Alexis. Thank you so much, and thank you all for being with us today. Do not forget you can catch our show anytime by logging onto Facebook and also onto our YouTube channel. Tomorrow, with nearly 4,000 COVID cases in Douglas County, how is the University of Kansas weathering the latest surge? KU Chancellor Dr. Doug Girod, he's going to join us with an update on getting back to class during this latest Omicron surge. We're going to find out how KU basketball fans have responded to the chancellor's mask ultimatum. We'll tell you what that's all about. And Dr. Stites is back as well. We'll see you here at 8 o'clock. Have a great Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.